how do you diagnose asthma and the severity of it?
Well, the majority of the diagnosis of asthma, as is so for many other diseases, is done on clinical grounds.
Okay.
So pretty much the history of the patient is probably the single most important factor. If there's a person that has a history of frequent repeated colds that last for a long time, weeks, and children that will catch colds 2-3 times a month, and their symptoms will persist for many days, that is a huge clue. Patients will report wheezing, sometimes wheezing at night. They're awakened in the middle of the night by wheezing or cough. Sometimes this is precipitated by exercise, in the case of what's called exercise-induced asthma. Individuals that do not have any symptoms normally, but physical activity will precipitate it. So those are primarily the history is our way of making a diagnosis. Obviously, also there's physical findings. There's prolonged expiration. There's poor air movement in the chest. There's wheezing. There's other abnormal sounds that we listen to in the lungs.
Is there a test that you perform to see if there is
asthma?
Yeah.
Yeah. The most classic test is the pulmonary function test, which is a breathing test that it takes about 20 to 30 minutes to perform, and the patient breathes through into a machine, being coached by a technician that tells them how to do a certain number of maneuvers, and we measure airflow and other parameters, and that's one of the tools that we utilize.